Good morning, good afternoon, good evening, wherever you might be on this lovely Saturday afternoon. I see that I do have some new followers for my YouTube channel, so I just would like to introduce myself. My name is Carrie. If you have found me, whether if it's on TikTok, Instagram, Facebook, welcome to Failing is Not an Option. This is my weekly question review. If you are in my group, you see that I post the questions every week, and I am going to do a review weekly. Some of the questions that a lot of us have questions on, not a quite good understanding of it, or if you're even second guessing yourself when it comes to the answer responses, I am here to walk you through them because it's much easier to kind of talk through them than like to be typing and texting a lot of the information, because sometimes I don't have a heap of a lot of time to do that, and it's best to hear it versus than when you're reading it because you have a better understanding. We are just going to walk through these questions. We are going to treat these questions as if we are taking the MFT national exam, reading the questions, highlighting some of those words, phrases, terms that stick out to us that is going to lead us to our best answer. And like always, feel free to pause the video, see if you can find the best answer yourself before I reveal what the best answer is. And if you find the best answer before I reveal it, kudos to you, and let me know how you found your best answer if it is opposite of what I am teaching on this video. Let's get started with the first question. A therapist is working with a couple who report a decline in sexual intimacy after the birth of their first child. The therapist's assessment reveals they are exhausted, have minimal time together, and have frequent low-level arguments about parenting. Their shared goal is to feel close again. What is the most appropriate initial response? Again, let's take a look at what the vignette says. Go back to it. Highlight those key terms, words, terms, phrases, whatever the case may be, so that you can find the best answer in the answer responses. So if we were taking this exam today, I would highlight a couple, decline in sexual intimacy, exhausted, minimum time together, frequent low-level arguments is something that sticks out to me. So when I look at my answer responses, my answer response needs to pave way to what is said in that vignette. And you will do this for the exam as well. The answer responses must pave way to what is being said in that vignette. Now we go back and look at the question because we want to make sure we understand and know what this question is asking us. They are asking about the initial intervention. What is the most appropriate initial intervention? Take a look at the answer responses. A says, teach a couple stress management techniques, brief moments of connection before addressing sexual concerns. That sounds good, right? Sounds like what we already see in the vignette. B says, explore the couple's individual sexual histories to identify possible past trauma. My issue with B is that it's digging in the past when we have something presently that is going on. We don't need to do that. We need to be formulating an initial intervention that is going to help presently with what's going on, not something in the past. C says, assign the couple to have a weekly date night to rekindle romance immediately. My issue with C is that it ignores that there is a decline in the sexual intimacy and there are arguments. None of that is mentioned in C. Get rid of it. D says, begin psychoeducation on child development to normalize the intimacy in early parenthood. I get it. It's normal, right? We want to normalize it, but that's not going to help them with the decline in the sexual intimacy and the arguments that they are having as being a newly couple with a child, right? Take a look at A. Teach them stress management. It is stressful. Their first child, right? It's stress management techniques. Brief moments of connection before addressing the sexual concerns that they have, right? They're stressed already. They got some issues going on, trying to, mitigate how they are going to now have this baby and also balance their sex life at the same time. A covers everything that is said in the vignette, making A the best answer response. I hope that you were able to find the best answer for that question. A couple reports fighting daily. They keep trying to solve it by improving communication, but the more they talk about it, the worse things get. Now, the question is asking about a MRI term. So when you are thinking about an MRI term, you must find an answer response that is directly connected to the MRI term. But then if we go back and look at the vignette, solve it. We know that MRI is about what? Attempted solutions. The problem is not per se, the problem is the attempted solution that you keep doing to try to solve the problem. That is why you keep getting stuck in those patterns. And a goal of MRI is to do what? Reach second order change. If we take a look at the answer responses, first order change sounds good, right? But let's look at the best of responses. Second order change. Second order change is what? That is a fundamental shift of the entire system. Beliefs, rules, ways that the system was operated has been changed all the way around. It's new. So it can't be second order change if they're still stuck in the same nonsense that they've been doing ever since the beginning. Reframe it. If you know what a reframe is, you know that that is not what is happening in the vignette. Do not pick an answer that you know is not the answer response that you should be looking for. A reframe is looking at a situation or this thing or something that is being said and we're putting a twist to it. It's not a reframe. D says a cybernetic feedback loop. It could be a cybernetic feedback loop, right? But it's not part of MRI, right? We need to be looking for a term that is going to best describe MRI. First order change is your best answer response for this question, okay? A mother brings in her teenage daughter who constantly texts her friends during meals and homework. The mom has tried taking the phone away, yelling, and even offering rewards for not texting. None of it has worked. We are still again looking at which MRI concept best explains the failure to change. Go back to the vignette. Let's look at some things. The daughter is constantly texting. The mom has tried taking the phone away over and over again and offering words. It does not work. Again, these are our what? Attempted solutions to solve the problem. More of the same keeps occurring because you keep doing these same attempted solutions and it's not working. Which MRI concept best explains the failure to change? Is this first order change? No. A first order change is what? It's a superficial change to the system. That's not what we're seeing here, right? B says problem maintaining behavior. It is problem maintaining behavior because the same stuff keeps happening over and over again. But take a look at C, attempted solutions. This is definitely an attempted solution. This is the best MRI concept. We're looking for the MRI concept that matches attempted solution. That is what MRI is about, the attempted solutions that we keep trying to do for the exact same problem that keeps occurring. More of the same, right? A client says, when I see how that politician ruins everything, I just want to make them pay. If I lived in that city, they'd be in trouble. They live in another state and they have no travel plans. The therapist should do what? So automatically know that this is a what kind of question. It's our duty to warn, protect question, right? Go back to that question and take a look at what is actually being said before you move on to find your best answer. I want to make them pay. They don't live in the same city and they don't have any travel plans. Those are your specifiers that you would highlight, that you would look for, that is going to lead you to your best answer. The therapist should do what? A says notify law enforcement in a politician's city. Here's the issue with that question, with that answer response. There's not enough information in the vignette, and now you're jumping too far. They'd be in trouble. They live in a whole nother state with no travel plans. So we don't even have a plan to report it. Before you can, activate the duty to warn, duty to protect, you gotta have a specific credible threat before you do so. Not enough information, get rid of A. B says treat the comment as venting and move on. First of all, we don't treat anything as venting when we have a threat. Harm to ourselves, harm to other people. We're not treating it as venting. That's an assumption. We're not assuming that this person is venting when they've said something like that. Get rid of B. C says assess for genuine intent and ability to act on a threat. Sounds nice, right? But let's take a look at D. D says end the session to de-escalate the situation. First of all, if you're ending the session, why are you still de-escalating the situation? You ain't getting paid for it. So you might as well just end the session and be done. You see how crazy that sounds? Why D is not the best response? C is the best answer. Assess for genuine intent and ability to act on the threat. You need more information. Even though he says he has no travel plans, I get it. A lot of people were saying that, but it says they don't have any travel plans. They don't have, any means to do anything. So why am I still going to assess? That does not matter. I don't care if that client tells you, hey, I don't have an initial plan. You still need to assess. You still need to assess the situation. And the rest of the other answer responses do not make any sense. If the question has vague information in it regarding like a suicidal plan or a duty to warn or protect or whatever, it is your job ethically to still assess the situation. You still need to assess. Do not ignore that. A therapist has been working with a lesbian couple for 2 months. During an intense session, one of the women brings up memories of childhood sexual abuse. The therapist lacks experience working with childhood sexual abuse, and the client is adamant that she doesn't want to go to an individual therapist. What the therapist should do? What? Go back to the vignette, pause this video if need be, see if you can answer this question yourself. We're gonna go back. Lesbian couple, 2 months, an intense session, childhood sexual abuse. The therapist has no experience, but that client doesn't want to go to an individual therapist, okay? Those are your main specifiers for how you are going to find the best answer. Don't forget about that. That's what we're looking for when we are looking for this answer response. A says, explore the client's reluctance to therapy. Nothing up there is mentioned that the client is reluctant to do therapy. So get rid of A. The only thing they said is that they don't want to go to an individual therapist, meaning that this client possibly has a good rapport with this therapist and they don't want to leave. Nothing about that is reluctant, right? B says, seek consultation from a therapist who is experienced in this area. Now, I like that answer response, but before we get back to B, let's take a look at the rest of the other responses. C says, insist that the client seek individual therapy in order to continue in couples therapy. My issue with C is you are now forcing or pushing your beliefs onto this client when the client has already told you they don't want to go to an individual therapist. So what can you do in order to help your client feel more comfortable? Because now this is probably going to make this client shut down, not want to do therapy all in all when you do that. You still have to think about your client before you start thinking about what it is that you need to do. When it comes to a referral or wanting your client to see an individual therapist or something, it's collaborative. It's not just what you want, okay? D says, concentrate on current issues in order to prevent the client from feeling overwhelmed about the past. But here it is, again, with D, you are ignoring that the vignette says you lack experience when working with childhood sexual abuse. That needs to be paved way too when it comes to this answer response, leaving B being the best answer choice. Seek consultation from a therapist who is experienced in this area, because B is going to allow you to work with this client on her child sexual abuse, and you might not have to refer out. You seek consultation first. Okay. Now, a 34-year-old woman begins therapy 2 weeks after witnessing a violent robbery at her workplace. Since the event, she reports feeling emotionally numb, having trouble sleeping, reoccurring intrusive images of the robbery, and avoiding going near the store. She startles easily and feels constantly on edge. She has no prior psychiatric history. Her symptom has been present for 12 days. Now, here it is. This is one of those diagnosis questions where we are going to have to pay attention to the length of time as well as the core symptoms that is being presented. Go back to the vignette. Highlight the symptoms, highlight the duration of the symptoms. Now, if you go back and look, you do have some traumatic symptoms that are being presented. Emotionally numb, trouble sleeping, intrusive images, she's avoiding going near the store. She's also hypervigilant because she's on edge. But it's only been present for 12 days. Take a look at the answer responses. Your first one is your distractor. PTSD is the distractor because you have some PTSD symptoms that are being presented. But the duration is not long enough because PTSD lasts how long? I'm not going to reveal it. Everybody, please leave your comment of how long does PTSD symptoms must last for before a person can be diagnosed with PTSD. B says adjustment disorder with anxiety. What are some core symptoms of adjustment disorder? Please leave it in the comments. This is all about us learning, right? But we need to know how to separate each of these diagnoses from one another because it's going to lead us to our best answer. C says acute stress disorder, but let's take a look at D. D says generalized anxiety disorder. If you are choosing an answer response for generalized anxiety disorder, that vignette better say something about excessive worry. That's your specifier. That is your key term for generalized anxiety disorder. C is acute stress disorder. That is your best answer response because acute stress disorder lasts for how long? It's going to be less than PTSD. Give me some answers in the comment section. I know you know this. I know you know this information. C is your best answer, acute stress disorder. Please give me your best answer response as to why C is the best answer response. I know you know this information. Leave me a comment in the session and we will move forward. I will let you all know if your rationale is the correct one. Let's move on. A 19-year-old college student referred for therapy by campus security after getting into a physical altercation in the dorms. She is reported feeling amazing, invincible for 1 week, sleeping only 2 hours a night, maxing out her credit cards on shopping sprees, talking rapidly in class. This follows a period of feeling empty, hopeless, and engaging in cutting behavior. She has a history of strained relationships and says, "People always leave me." Go back and take a look, because I know this was a question that had everybody kind of tripped up on. But if we go back and we're highlighting some of these core symptoms and these what's descriptive about this disorder, it's going to lead us to our best answer. We take a look at she's been feeling amazing and invincible for 1 week, and she's only been sleeping 2 hours a night. That's 1 week. Which one of these diagnoses between this bipolar 1 and bipolar 2 has a manic phase for 1 week? If you have a manic phase for 1 week, it cannot be the other, because the other doesn't have a full-blown manic phase for 1 week. It only has hypomanic for 4 days. That's how you find your best answer with this question, right? But then it's followed by the empty and feeling hopeless. That's your distractor. Okay, let's look at these answer responses. A says borderline personality disorder. That's also a distractor, because a history of strained relationships and people always leave me. That's your little abandonment thing for a borderline personality disorder. But get rid of it, because it's not enough information for us to choose that it is borderline personality disorder. Now, take a look at C, bipolar 2 disorder. And I get it. We can say it's bipolar 2 disorder because you see a manic phase, and you're also going to see a depressive symptoms that are being presented. But if you go back and look at the vignette, 1 week of that manic phase lets us know that it's not bipolar 2, it's bipolar 1. Bipolar 2 has a hypomanic phase, 4 days, with a depressive symptoms for 2 weeks. That's why bipolar 2 is not the best answer response, because there's a full manic phase. Getting rid of bipolar 2. Bipolar 1 has to come with 1 manic phase. You do not need depressive symptoms in order to have bipolar 1, but you do need those mania symptoms to last 1 week, which is being presented in this vignette. It cannot be bipolar 2, because you have a full mania phase for 1 week. If it were bipolar 2, it should say something about 4 days, maybe less than 4 days or whatever, for hypomania, so that you can have the hypomania and the depressive symptoms that are presented in this vignette. That would lead you to answer C. But the best answer is B, because she had the mania phase for 1 week. It gets rid of bipolar 2 because it was 1 week and not the 4 days. That's why this answer is B and not C. And you know it's not D. We don't even have to get into ADHD. We know that there are no symptoms up here that are letting us know that it's ADHD. Okay? That's why B is your best answer and C is not the best answer. A 32-year-old woman comes to therapy stating that she has lost interest in everything for the past 6 weeks. She has struggled to get out of bed, feels exhausted, has difficulty concentrating, and cries frequently. She denies any substance use. Her appetite is diminished, and she reports having suicidal thoughts, but no plan or intent. What is the most appropriate diagnosis? Pause the video, see if you can find this best answer, but go back. Highlight those symptoms that you see presented. It is always the strongest symptoms that are presented that leads you to your best answer. Take a look. Lost interest in everything. 6 weeks she has struggled to get out of bed, difficulty concentrating, and she's crying frequently. She denies any substance use. Her appetite has also diminished. Those are your core symptoms that is going to lead you to your best answer. A says persistent depressive disorder. Persistent depressive disorder lasts how long? 2 years. 2 years. You see 6 weeks, so you're automatically going to get rid of it. C says bipolar 2 disorder. We don't have any hypomania, so we automatically know that bipolar 2 is out. Adjustment disorder with depressed mood. Now, here's the issue with D. Adjustment disorder has to come with an identifiable stressor, which is not listed. An identifiable stressor is like what? Divorce, loss of job, etc. That's not listed, so you're automatically going to get rid of D, leaving B being the best answer. Major depressive disorder. You will have 2 weeks of depressive symptoms. 5 symptoms must be presented. At least two must be what? A loss of interest and a low mood. That is listed here, leading B being the best answer response. A 42-year-old male presents with symptoms of anxiety, chest tightness, and dizziness. He is convinced he is having a heart attack, though emergency room visits has ruled them out. What is a crucial next step in the assessment? This question actually tripped up a lot of people. I got this question from Quizlet, and I'm pretty sure it's from AATBS or one of these other answer responses. So I'm going to teach this the best way that the rationale taught me how to do so. So if you go back and highlight, you see symptoms of anxiety. I get it. It's telling us this is what this client has, right? But take heed to that's not what this question is about. What is your next step in the assessment? Chest tightness, dizziness, feels like he's having a heart attack. That leads you to what? Okay, I know it's something because he has chest tightness and he's feeling like he's having a heart attack. It sounds like it's a panic attack, anxiety attack, whatever the case may be. Emergency room visits has been ruled out, right? What is the crucial next step in your assessment? A says begin panic disorder treatment immediately. You don't know if he has a panic disorder. You haven't done an assessment to do so. So please don't pick an answer response that has you giving this person a diagnosis and you have not taken what you need to do in order to come up with that diagnosis. B says refer for a full medical workup to rule out somatic causes, right? So let's take a look at the other responses. C says diagnosed with illness, anxiety disorder. Be careful with answer responses that have you diagnosing anything and assessment hasn't been done. Unless that's the best answer of the four. I will say that. D says ignore the physical symptoms and focus on cognitive distortions. Now here's your issue with D. You don't ever ignore any symptoms that are being listed in the vignette. Please don't ignore any symptoms. If it's symptoms there, they're there for a reason. Do not ignore them. Do not be like, well, I'm ruling that out. Don't do that. Pay attention to what is being said. Now, out of the four answer responses that we have here, B says refer for a full medical workup to rule out somatic causes. That is your best answer response because A says begin panic disorder treatment immediately. You can't do that because it's asking you for an assessment and you gotta assess. And the way that you are going to assess is referring for a full medical workup. Again, C is diagnosing. Please be very cautious about choosing an answer response that has you to diagnose. If that's the best answer out of the four, then hey, have at it. But if it's not, please stay away from them telling you to diagnose when you have not done an assessment that leads you to your diagnosis. And please, for the love of God, do not ignore physical symptoms. Physical symptoms is a red flag that should never be ignored in a vignette because it means that it's something that we cannot do because it is outside of our scope of what? Our scope of practice. We are not medical doctors. Do not ignore physical symptoms. That brings us to our end of the review of the questions that we did this week in the Felon is Not an Option group. If you still are struggling with understanding the rationale to these questions, please leave me a question, comment, or concern, and I want to help you so that you can be able to navigate these questions the right way when it comes to the actual MFT national exam. I don't want to leave anyone behind. I don't want to leave anyone still second guessing themselves. So if you still have issues with understanding how to find these best answers, please leave me a message, question, comment, or concern. I want to be able to support each and every one of you. I can do another video. There are more questions that I am going to do a review for. The video is coming soon, so please be on the lookout for it because, like I said, it's easier for me to talk through these questions with you than for you. You know, it's easy for you to hear it than to read it. I'm able to walk it through easily if I'm speaking to you about these questions. So be ready. There is another video that is coming for the weekly review of questions that we did do in the group for this week. Again, if you need me, I am available. I am around. Just let me know. I am here. Please enjoy the rest of your Saturday.